So I have a devastating and terrible story about our healthcare system here to talk to you about. Take a look. Americans borrowed a staggering $88 billion in the past year to pay for healthcare. A new survey finds about 1 in 8 had to resort to borrowing to afford care in the previous year, according to a West Health-Gallup survey released Tuesday. Also, 65 million adults say they had a health issue but didn't seek treatment due to cost. Wow. Nearly a quarter had to cut back on spending to pay for healthcare and medicine. Quote, not only do you have a real significant number that are deferring care, foregoing care altogether, you also have a big chunk that are getting the care but having to borrow to get it, said Dan Witters, Gallup senior researcher. There are few Americans out there who are safe from the American healthcare cost crisis. These statistics are the latest examples of how the nation is struggling with the high cost of medical care. The United States spent more than $10,700 per person on healthcare in 2017, federal data shows. That's more than any other country. Yet America consistently ranks near the bottom of major health indices. Major health indices? I've never seen that word before. Among developed nations, the survey said. $88 billion in the past year to pay for healthcare. That's what was borrowed by Americans. $88 billion. 65 million adults had a health issue but didn't seek treatment due to the cost. This is a failed system. This is a broken system. By the way, you know who one of those people was? Who one of those people was? One of those people were? I am like, for a talk show host, I sure don't know how to talk. Because there's at least one incident a day where I'm like, I say something and I'm like, is that real? Did I just make up that phrasing? Okay, my father was one of these people. My dad was. He passed away in 2011 from lung cancer. By the time he went to the hospital, it was already stage 4. It started in his lungs and metastasized to his spine. He had surgery. They found out when they did the surgery, it was basically impossible to take out via surgery. And they scheduled, like, okay, we're going to try to do chemo and radiation on this bad boy. But it was already stage 4 cancer, and he was dead within a week, maybe 2 weeks after the surgery, where they found they couldn't take it all out because it would have risked further injury to try to cut it off of the spine or something to that effect. He didn't go to the doctor for the longest time because he didn't have health insurance. That's a lot of people. And also, so not only is that system fucked up, also my dad wasn't the brightest bulb. When he first started getting back pain, he went to a chiropractor because the chiropractor is much cheaper. And the chiropractor would tell him, like, no, come on, keep coming back. We'll fix this. We'll get your back pain out. Just got to keep going through our routine and going through our schedule here and going through the steps with our appointments. And basically, the chiropractor was telling him, you don't have to go to a real doctor. You come here, and we'll crack your back until it's fixed. Well, it turns out that was a deadly decision on my dad's part, and it was deadly on the part of the chiropractor, and I would argue it's probably gross negligence on the part of the chiropractor to insist that, like, no, you don't have to go to a real doctor. Just come here. We'll fix it. We'll just keep cracking your back, and somehow we'll get rid of the pain. Well, come to find out, that fucking pain was cancer. It was cancer. So think of all the ways. So obviously I have a seething, passionate hatred for pseudoscience and non-medicine that pretends to be medicine, including chiropractors. Okay? They're just glorified backcrackers and massage therapists pretending to be more than that, which is fucking dangerous. So I hate pseudoscience, and I hate our healthcare system, because if we had a Medicare for all system, and my dad felt pain, or that first time my dad felt a little thing in his back, or first time he was coughing all day, and he thought, this doesn't feel like a cough or a cold, but I'm coughing, this is weird. If we had Medicare for all, there's a chance he would have just went to the doctor right there. Right up front. And then, oh, look at that. We caught it and it's stage 1 or it's stage 2, and your life could have been saved and he could still be alive today. So, in all seriousness, my father is probably one of those between 32,000 and 45,000 people that die every year because they don't have access to basic health care. And it's not like, just for the record, it's not like he wasn't somewhat okay financially. It's a long story. Him and my mom split up a long time ago. There was a divorce, and it was a little ugly. And then, as time went on, he didn't make the best financial decisions. And so there was a time when he could have been considered upper middle class. By the time that he got sick, he was honestly probably lower middle class because he had a lot of debt. But he still was better off financially than a lot of people in this country. And he was a victim of our healthcare system being so shitty that he was thinking, I can't afford it to go to a real doctor, so I'm going to go to the chiropractor. And then eventually he had to go into the emergency room, and when he went into the emergency room, he basically got his death sentence. You're stage 4, you don't have long to live, and that is what it is. And I was naive throughout the whole experience. I was thinking like, oh, he'll be all right, probably. Because when I was a kid, there was one time I remember he had this excruciating pain from a tooth issue he had. And it was like a nerve problem or whatever. But I remember him being in excruciating pain and like laying in bed and just, it was horrendous. But then, whatever. I guess he got some dental work or something. And then 2 weeks later, he's fine. And so in my naive mind, and I wasn't young, this was 2011. So I was born in 88. I don't know, you do the math on that. Or 2010 this was. So 88. 98, 2008. So I was 22 at the time. That's not young. But I was looking at him, you think like your parents in a weird way, you think like they're not immortal, but a little bit bulletproof, if you will. Like, yeah, it'll be all right. We'll get through it. But no, it was naive. And this was nothing like the tooth pain from when I was a kid. That's when the tooth pain thing happened. The cancer was 2010, 2011. But I thought like, subconsciously, I thought this will probably be like the tooth thing where he's in and out. He'll be all right. Went in there, stage 4 cancer, dead not too long after that. So, that's our healthcare system, bro. Listen, 65 million adults say they had a health issue but didn't seek treatment due to cost. 65 million. 65 million. The system is utter trash. And anything and everything should be done to reform it. We need to get Medicare for all. It's a life or death issue. People can't wait. How many of my dads are out there right now? Right now. At least hundreds of thousands, probably millions. Not all these 65 million have life-threatening issues. Some percentage of them do. And 88 billion had to borrow in order to pay for healthcare costs. Again, one of the top causes of bankruptcy in America is healthcare bills. That doesn't exist in Canada or Norway or Denmark or Iceland or Sweden or Finland or Australia or the UK or France or New Zealand or any of the other places with a single-payer system. Doesn't exist. Depressing. I wish I didn't have to report this news to you, but I have to report this news to you. And now, listen. Go ahead. Go turn on CNN. Now, to be fair to some of the mainstream outlets, and I don't make this distinction enough, and I should, because it's an important one, but yes, mainstream outlets, usually when it comes to print, they do a decent job, and they'll cover real stories that matter deeply, okay? But that's just print. When you turn on CNN, turn on the TV, or turn on MSNBC, or turn on the nightly news, they don't talk about the serious issues like this, man. You just got more of an education on our healthcare system from me, the numbers I just read you, and my personal story than you'll ever get from a mainstream outlet. And that's depressing, and that's sad, and that's pathetic, and it shouldn't be the case.